Hi, my name is Elizabeth Allen. Most people know me as Libby. I am an advanced practice registered nurse working in rheumatology. I graduated from Graceland University at Independence campus in Kansas City, and I've been practicing rheumatology for the last 3 years. Well, rheumatology in general is an inflammatory arthritis, and there's different categories that inflammatory arthritis fall in under. There is rheumatoid arthritis, there's psoriatic arthritis, there's gout, connective tissue diseases, lupus, scleroderma, a lot of autoimmune conditions. So there's a wide range of disease processes that we treat in rheumatology. Well, rheumatology actually chose me. I was contacted about a potential position. I had worked with some other nurse practitioners, and they felt like rheumatology would be a great career choice for me. So once I started following Dr. Robert Jackson, who was my collaborator and teacher, I learned much more about the involvement of rheumatoid illnesses, inflammatory arthritis in general, and the population that suffer from the inflammatory arthritis. So it became a passion of mine to treat these patients and give them better quality of life. Symptoms usually include joint pain affecting one or both hands. They will affect the wrists, the elbows, the shoulders, hips, knees, ankles, feet. Low back pain, like in ankylosing spondylitis, which is a rare form of inflammatory arthritis that affects the low spine and pelvis. So a lot of fatigue and just overall not feeling well. Well, each plan is individual for the patient itself and the disease process that they are being treated for. It can range from oral medications to injections to even infusions in the hospital. Appointments usually vary. You can self-refer to rheumatology. It just depends on your insurance, but most of the time your primary care can refer you for an evaluation. If you're having any joint pain or any of the symptoms that I listed, sometimes you can just ask your primary care to be referred to rheumatology so you can get a thorough workup just to make sure you don't have an underlying inflammatory arthritis that's been undiagnosed. Most of the time, the first diagnosis includes a thorough history, and we spend a lot of time talking about your symptoms, when they started, how long they've been going on, what joints are affected. We'll usually grab labs or x-rays if your primary care has not obtained those. And then your follow-up visits, we will usually review all those labs and the diagnostic imaging that we've obtained in detail, and we'll form a treatment plan at that time. It typically, you have to follow pretty closely with rheumatology because some of our medications are high risk. So I typically follow my patients once they're stable every 3 to 4 months. Some I usually follow more frequently, 4 to 6 weeks or 6 to 8 weeks, depending on what type of treatment we've started. We can also follow osteoporosis and osteopenia, making sure that we get proper treatment started initially and quickly to reduce poor outcomes when it comes to fractures related to osteoporosis.